We're starting off in our LCMC Health Wellness Lounge because throughout the hour, we're going to be talking about conversations when it comes to kids and eating habits. We all know during the summertime, right? Kids are at home more and their healthy habits may be going down because they just have more time at home to reach for an unhealthy snack. We don't want that to happen. So today, we're first talking about childhood obesity and what parents need to know about the condition. Join me now for a conversation is Dr. Anthony Hudson. He's a pediatrician with Manning Family Children's. Good to see you.
Yeah, good morning. Thank you for having me. Really excited to talk about a subject that's, I find, very important.
Absolutely. I think it's important as well because, look, Whitney Houston says it best. I believe children are the future, okay? And first, let's talk about the severity here in Louisiana. How bad is childhood obesity right now?
You know, unfortunately, Louisiana ranks amongst the highest 5 states with obesity. You know, if you were to look at our country as a whole, I think geographically, you know, the Mississippi River Valley, unfortunately, is hit with obesity the hardest. The exact numbers really kind of blend together, but Louisiana is definitely in the top 5.
It's unbelievable. When we look at the percentage, about 20% of youth ages 6 to 17 suffer from childhood obesity, which is unfortunate. And of course, a common reason, we all know why. The food here in Louisiana, it is delicious, it's flavorful, it's seasoned, but it's often unhealthy. But there are some other reasons why child obesity is also prevalent here in Louisiana, like access to food is a problem.
Sure, I think the term you're hinting at there is a food desert, so access to food, and then even more broadly, that reflects just socioeconomics in general. We do know that people with less income disproportionately consume higher amounts of ultra-processed foods. So it's really a multifactorial problem.
Absolutely. And of course, genetics is also a problem as well. If your parents maybe are obese, it's more likely that the child may be obese as well. And that's why it's important that we talk about this. When we talk about the word obesity, right, one of those big words is BMI, right? That's how they figure out if someone is obese or not. Explain to us how that works, especially in a child.
Yeah, so BMI is a really crude tool. It is a simple equation of your height and your weight. There are more appropriate ways to measure your total body fat, such as perhaps the amount of fat you have here on your arm. But we do use BMI to define obesity. Unlike adults, where it's a certain number, such as a BMI greater than 30, with children, and children always growing, we define obesity in children as a BMI greater than the 95th percentile for their age.
A lot of times they're like, oh, they'll grow out of that baby fat. You know what I'm saying? Sometimes it's not, because when it comes to obesity, besides weight, there are some other physical signs that parents need to be on the lookout for. What are they?
Yeah, I really like that you start that with saying they'll grow out of this. You know, some of the youngest ages we can tell that this toddler's weight or BMI will correlate with adult obesity starts around age 3 to 4. You know, children are naturally losing their baby fat or brown fat in the first few years of life, and then start to gain white adiposity as they age into the toddler and childhood ages.
Come on, look, we just learned a new word. Forget saying baby fat, brown fat. I like that. Come on, very good to know that as well. There are also some behavioral signs as well, besides the physical signs, which are shortness of breath during normal play, fatigue, joint pain. When it comes to what's happening on the inside behaviorally, what do we need to be on the lookout for?
Behaviorally, I think things like depression, bullying, maybe some cues that parents could pick up on, as well as, again, working with their pediatrician, going for yearly well visits and reviewing their growth in detail with the growth chart.
It's so important. You're seeing some more there. Depression, bullying, all that can unfortunately be caused by childhood obesity. And it's important that parents understand that we need to have these conversations now, because in the end, there can be some long-term factors that can happen because of childhood obesity. Type 2 diabetes, for example, is a common one. What are some of the other conditions that can happen because of childhood obesity?
Yeah, with growing rates of obesity in the pediatric population, we're seeing some of these adult chronic conditions now in the pediatric population. Children as young as 13, 14, 15 having type 2 diabetes. You know, so we're seeing these chronic medical conditions at earlier and earlier ages now.
Here's my thing, doctor, because, you know, long-term risk, high blood pressure, high cholesterol, sleep apnea, all conditions that can happen because of childhood obesity. as parents, they understand why we need to have this conversation, right? But how does a parent go up to their child, whether they're 9, 10, 11, 12, any age under 17, right? How do they communicate to their child, this is a problem, we need to work on this together?
Yeah, really, I think this question needs to be answered in terms of what age the child is. You're going to approach this problem differently if the child is 4, 10, 17. I think as a child, really you need to look within as a parent and make sure that you're acting appropriately, really reflecting the behavior that you would like your child to have. And then as they age and they reach this age of reason, 7, 10, you can start to speak in a little more detail about why we actually do this. And then I think as a teenager or into your early 20s, you start to be able to understand the long-term implications of some of the decisions you're making now. What you're choosing to eat now may have implications on your life or your quality of life as a 40, 50, 60-year-old individual.
And is it okay to use words like obese? Because obviously as a teenager, when you're dealing with preteens and teenagers, those words can cause like emotional tolls on them,
Yeah, I think a leading question that's appropriate is to ask your teenager if they feel comfortable speaking about this and making sure the environment or the table is set appropriately, pun intended, to speak about that issue.
I love it. Look, at the end of the day, beautiful people, we need to have a conversation like this because, again, like I read earlier, approximately 20% of youth ages 6 to 17 are dealing with childhood obesity just in Louisiana alone. So it's important that we have a conversation like this. Doctor, thank you so much for being here. Look, everybody, if you have more questions about this, log on to Manning Family Children's.org. I think that's the website. We're going to see it in just a little bit. ManningChildren's.org. That's the website. They have a lot of great resources there. Look, everybody, we're just getting started. Doctors sticking around because obviously we just talked about the problem, right? But what are the solutions? One of the big ones is what kids are putting on their plate. More healthy habits and a healthy diet for kids after the break.